Good afternoon, everyone. Thank you for the invitation and the kind introduction. What I would like to do today is within the next 15 minutes to give you an introduction about metabolomics in glioblastoma. This is our project here at UC Davis. I will try acknowledging the people that help make this project a reality. I have my mentors here and our collaborator at the outside institutions. As our previous speakers have alluded to the state of science right now with the glioblastoma in particular, the treatment for these diseases has included of neurosurgery, radiation therapy, and systemic chemotherapy, and we're still faced with a lot of limitations and challenges, including a list of limitations that includes the early detection, disease monitoring, along with other limitations as shown in this list. I will be concentrating our discussion today regarding using the metabolomics in early detection and disease monitoring for glioblastoma. This is a graph which I believe everybody here knows about regarding the standard of care of glioblastoma, how we use the STOOP protocol, and how we fail over the last 15 years of moving the needle and giving patients more meaningful recovery and increased survival. Here in the advances over the last 20 years have brought new avenues of using new technology, including proteomics and metabolomics for sure, in different types of cancer, along with other science avenues. And I appreciate that not everybody would like to look at biochemistry and look at these complicated graphs of biochemistry and types and subtypes of these compounds. But this is actually what metabolomics is all about regarding these, what we called superclasses and subclasses and small metabolites, which what we eat and what we are exposed to transferred into small molecules. I usually like to have the picture of this as like the highways and the interstates of the United States, especially here and shown here in the picture of the map of California. How do you see the superclasses here of the big highways, and you go to more detailed subclasses and more smaller and smaller metabolites until you get to the small roads and alleys in every city. And this is what we are trying to do here in the UC Davis West Coast Metabolomics Center. When we look at the metabolites from the metabolites which are targeted and known, and move into the untargeted or unknown metabolites, which we are trying to look into from the tumor tissue and also from the cytoplasma. What is known regarding using metabolomics in the cancer field, actually, cancer initiation is associated with specific changes in the cellular metabolism, and metabolomics have been utilized in different cancers, including lung cancer and breast cancer, in specific to be used to monitor disease and check on recurrence. This is our project in summary. As we shown on the STOOP protocol, what we try to do here is take sample collections from patients undergoing concurrent chemoradiation followed with adjuvant temozolomide. We take samples before surgery, after surgery, before radiation, after radiation, as shown here in this graph. What we are trying to we ask two different questions. The first question is there any changes in the metabolites with longitudinally when you look between in the same patients before their surgery, after the surgery, and during their treatment? Whether any of these metabolites will be able to guide us regarding the response to treatment and detection of recurrence of the disease. Further, we ask the second question is whether there is any unique characteristics of metabolomic changes in patients depending on the treatment they receive, whether surgery have changed the metabolomic profile for these patients, whether radiation did that, whether treatment with temozolomide have make this difference. The summary, we have about 36 patients with IDH wild type MGMT methylated or unmethylated glioblastoma. We followed these patients longitudinally for at least 2 years, and we collected 145 samples out of these patients. It depends on the situation of every patient. Some patients we were able to get 9 samples from the same patient, which will help us have a longitudinal look at the changes. And we are still in the process of analyzing the data from these metabolomic studies that we were able to do at the UC Davis West Metabolomic Center. This is I'm going to give a couple of slides regarding unpublished data that we were able to collect. And this is a volcano plot here, which will show us in the right upper corner, which is highlighted with blue, the metabolites that they were upregulated after surgery compared to pre-surgery, while the what is shown here around were surrounded with the red shape here. This is the metabolites that they were downregulated after surgery. And on the right side, you can see what kind of superclasses of these metabolites in this. Now, the interpretation for these metabolites is to follow, and it's going to be extensive. But just to show here that every maneuver that the patient is going through, it's reflecting on their plasma with their metabolites. This is another stage of their treatment where we looked at the patients before their concurrent chemoradiation and compared it with the post-concurrent chemoradiation. And we can see that the metabolites here, the classes of metabolites, number of metabolites have decreased after you have gone through the surgery and you are now into the pre versus post-radiation phase. And you can see how the carbohydrate, the fatty acid, the organic acid, etc., are showing here in blue that some of them, they are upregulated while others are downregulated, which they are less. Now, the picture is not always that straightforward and simple, and I will show here how the metabolites themselves are a cluster of metabolites, and if you add to the metabolites, you add to them lipidomics, also you end up with a more complicated picture. Well, that's how we move into analyzing these data, and that's how the AI machine learning will be able to help us with that. This is when simplification of the metabolites that increased over time with different stages of treatment with longitudinal studies here. Now, looking at pattern of how things are changing and whether we can have a collective information out of these scattered metabolites. And this is I'm showing here how this is a predictable changes that we were able to monitor of these patients. Here I'm showing a list of metabolites that after the first surgery, they all were downregulated. Some of them, they are exogenous and they are coming from medications that we give the patients, but some of them, they are not. Now, to confirm whether this is related to the surgery, we monitor these patients until they have their second resection, which is after recurrence. And this is another list of metabolites, which they were downregulated after the second resection as well. Now, the question comes is whether is there any similarities between the two surgeries? And the answer is yes. Here, showing the metabolites that were downregulated after the first surgery, and yes, they were downregulated after the second surgery in these patients. So these are the metabolites that we're going to be concentrated on to see whether we will be able to utilize these metabolites as a way to diagnose the response to treatment, especially to surgery. Just and this is a small sum. This is I know that this, with the time restraints, this is going to be a short presentation just to give you an access about summary about metabolites. Hopefully, I was able to give you some information to help that metabolomics carries the potential as a diagnostic tool of the plasma in patients with glioblastoma for future studies. And this is a low invasive patient sample that we can collect by plasma, and we'll be able to get us some information about the disease. We're going to be using this metabolomics data. This will be used to introduce new prediction models in machine learning with our colleagues, and we hope in the future that metabolomics can make it to the clinic and can help us understand the mechanism of drug resistance. These are some publications that we have so far on this project, and I think we have a lot to think about down the road. Thank you again for the organizers for this important meeting, and I would be happy to answer any questions.